All right, welcome to the adolescent development portion of the growth and development series. So in this video, we're focusing on adolescent development, which roughly includes ages 12 through 18. Now, adolescence is one of the most heavily tested stages on HESI, especially when it comes to identity, risk-taking, communication, and confidentiality. Adolescents are not just big kids and not quite adults. They're in a unique developmental stage that requires a specific nursing approach. So here we see three distinct phases of adolescence. Early adolescence, so roughly from ages 10 to 13, middle adolescence, ages 14 to 16, and late adolescence, ages 17 to 20. Now, within each of these boxes, you see that there are some distinct and unique developmental milestones that adolescents are going to reach in each section. Okay, now it's important to note that every individual is going to reach these stages within their own time and at their own pace. So, this is a generalized guideline for us. However, there are going to be variances that we see within our practice. Now, according to Erickson, adolescents are working through identity versus role confusion. They're trying to answer the question, who am I? This includes exploring beliefs, values, career goals, friendships, and personal identity. Questioning authority, experimenting with appearance, and changing interests are all normal parts of this process. Now, adolescence is marked by a rapid physical growth and sexual maturation. Puberty typically begins earlier in females than males, but the timing varies widely and is still considered normal. Growth spurts often cause temporary clumsiness and changes in body proportions. I'm going to repeat that one. Growth spurts often cause temporary clumsiness and changes in body proportions. So now this can affect self-esteem and it can also affect coordination. So think about, the adolescent that is having a bit of coordination issues with their high school sports. Now, in order to support the physical health of an adolescent, there are some guidelines that we generally like to go by. So, adolescents, we're looking at engaging in 60 minutes of physical activity every day. Now, this isn't just for physical health, but it's also going to help with mood regulation, especially because hormones are changing during this time, during puberty. So, it really is beneficial for overall health. Now, in terms of intensity, we're looking at including activities of vigorous intensity at least 3 days per week. So think running, swimming, or even doing team sports. Okay, anything that's going to help us build that cardiovascular fitness. Cognitively, adolescents are entering Piaget's formal operational stage. This allows them to think abstractly, consider hypothetical situations, and reason about moral and ethical issues. However, just because adolescents can think abstractly doesn't mean they always use that skill. especially in emotionally charged situations. So, to remember for Hesse, adolescents may understand risks, but they still end up taking them. Okay, now risk taking is common in adolescence and is tied to brain development. The emotional center of the brain matures faster than the area responsible for judgment and impulse control. So, this explains behaviors like experimenting with substances, unsafe driving, or risky social decisions. Now, Hesse tip: risk taking is developmental, so education and guidance are key. Now, peers become extremely important during adolescence. Acceptance by friends can strongly influence behavior, sometimes more than family opinions. Adolescents may conform to peer norms to feel a sense of belonging. So, for Hesse, we often can see questions talking about how peer approval often outweighs parental influence during this stage. Now, for moral development, so remember thinking Kohlberg, most adolescents are in Kohlberg's conventional level of moral development. They follow rules to gain approval or maintain social order, though some may begin to move toward post conventional thinking as they mature. Now, emotional ups and downs are common in adolescence due to those hormonal changes we were talking about. Now, there's also some increased stress and identity formation. While mood swings can be normal, persistent sadness, withdrawal, or changes in behavior may signal depression or anxiety and should be taken seriously. Okay, so we never want to dismiss suicidal statements as normal teen behavior. Now, body image becomes a major concern during adolescence. Physical changes, media influence, and peer comparison can impact self esteem. Nurses should promote healthy body image and discourage harmful behaviors like extreme dieting. Now, effective communication with adolescents requires respect, honesty, and privacy. Adolescents are more likely to share information when they feel heard and not judged. Providing private time during health visits is essential. Okay, now that confidentiality that we provide encourages honesty in adolescent care. Now, health teaching during adolescence often focuses on sexual health, substance use, mental health, nutrition, and injury prevention. Education should be developmentally appropriate and encourage decision making skills. Okay. Now, another major priority in adolescence, like I mentioned, is injury prevention. Motor vehicle accidents, sports injuries, and risky behaviors are leading causes of harm. Nurses should emphasize seatbelt use, helmet use, and safe choices. I know the helmet might not be the most fashionable, but I'm sure that they would like to keep their noggin after they end up hitting their head. Okay, now a Hesse tip to remember: unintentional injury is a leading cause of death in adolescence. Okay, now to wrap up adolescent development, I want you to remember this. Identity formation is the central task. Their abstract thinking is emerging. Risk taking is developmental. Peer influence is strong. Respect and confidentiality build trust. And supporting adolescents through this stage sets the foundation for healthy adulthood. All right, in the next video, we are going to be looking at older adult development. I'll see you in the next one.